This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
1 in 10 women experience endometriosis. It's a chronic inflammatory disease which often causes severe pain. And every woman's experience with endometriosis is different, but most will experience pain similar to cramps and sometimes worse.
Pain should not limit your ability to live a normal life, participate in activities.
Now, it's often missed or dismissed.
I ended up probably seeing 10 to 15 doctors in a 9-month period.
We'll explore what to watch for and the treatments available for women straight ahead in this week's edition of Prescription for Life. Hello, and thank you for joining us. I'm Monica Robbins. This is an important conversation because today we're shining a light on endometriosis, a painful, debilitating disease that impacts millions of women and puts them in pain that can significantly affect a woman's quality of life. Our expert is here to tell us more about this disease and why it's so misunderstood and hard to diagnose. But first, our Texas TV station finds out more about the disease and how it can disrupt so many lives.
Pain should not limit your ability to live a normal life, participate in activities, and that there are things that we can do to help.
Dr. Ann Porter is an obstetrician and gynecologist with University Health and an assistant professor with UT Health San Antonio. She says the disease isn't just about physical pain.
Endometriosis can be associated with both an increase in depression and anxiety.
Some of the risk factors of endometriosis are women who have never given birth, started their period at an early age, women who have gone through menopause late, women with short and or heavy menstrual cycles, and those with high levels of estrogen.
Family history influences a patient's risk of developing endometriosis. If you have a first-degree relative, you're about 7 times more likely to have endometriosis.
Endometriosis affects about 1 in 10 women, but that's a rough estimate. However, when women report pelvic pain or fertility issues, it is found about 50% of the time. When it occurs, that tissue that belongs inside the uterus can be implanted on tissues covering organs in the pelvis, like the ovaries and the fallopian tubes.
Sometimes implants on the bowel, bladder, and can be found really actually anywhere in the body.
Some of the symptoms include painful periods, pain with intercourse, pain during bowel movements or urination, excessive bleeding, and also infertility.
It can affect the fallopian tubes, it can affect egg quality, and it can affect implantation.
For more on endometriosis, including why this is so hard to diagnose, we turn to our expert from Cleveland Clinic. Joining me now is Dr. Megan Billow, an OBGYN with Cleveland Clinic. Thank you so much for being here.
Thank you for having me.
All right, so for people who may not understand, what exactly is endometriosis?
Endometriosis is a chronic inflammatory condition where women have tissue that's similar to tissue that's in the inside of the uterus, but that tissue gets outside of the uterus. So the tissue can, most commonly, it's found on the ovary. It can line the pelvis. It can affect the fallopian tubes. You can find it in the muscle of the uterus. Oftentimes it will also start to invade into intestines, sometimes the bladder, and you can even find it near the heart and the lungs.
Wow, I never realized it was that expansive or could be. So how is it diagnosed?
So we've made a lot of improvement over the past several years in order to diagnose this condition. The gold standard of truly being able to diagnose the disease is using a procedure called laparoscopy, which is where a patient is under general anesthesia. We make a little incision in their belly button, put a camera inside, and we see if they have the disease. Because it does require surgery to diagnose the disease, there has oftentimes been a delay in diagnosing it. So because of that, there have been advancements in improving diagnosis through clinical symptoms as well as imaging, including MRI and ultrasound.
So what are those symptoms that a patient may be experiencing?
So a lot of times patients will present with painful periods. It's the most common presenting complaint that we see with endometriosis. They may also have non-specific pain symptoms such as pain with bowel movements, pain with intercourse, sometimes pain with urination, and a lot of other very non-specific symptoms as well, such as fatigue or just overall not feeling well.
Are any women at higher risk for this than others?
So that's a great question. We're also trying to find kind of what puts a patient at risk of having endometriosis. We do know that it is an estrogen-driven disease, so any states that cause higher estrogen in the body may predispose a patient to having endometriosis. So things like early menarche or time of having their first period, some patients who don't have pregnancy because pregnancy does decrease the estrogen state may also be at a higher risk. We do know that there is a genetic predisposition to endometriosis and that patients who have a first-degree relative have a 7 to 10-fold increased risk of having the disease.
So by the time a patient actually starts experiencing the pain, are they in their teens or this 20s or 30s?
So endometriosis can affect patients of all ages. We do know that we most commonly see it in reproductive age women. However, it can present in adolescence, and we are really pushing to make earlier diagnoses of the disease. So if a patient is having periods that is causing them to miss school or really not participate in their daily activities, then that would be a warning sign of a patient having endometriosis.
So I'm guessing these pains are not the typical cramping that we think of. What kind of pain are we talking about?
Exactly. So some cramping is okay or acceptable to have during periods, but pain that really is impacting a patient's quality of life or making them stay in bed all day is not normal. So that is a really big warning sign that a patient needs to seek out care to find out what's going on.
Is it a heavier period typically too, or a lighter period?
Sometimes we may see irregular bleeding or heavier bleeding. Patients may have a condition that's called adenomyosis, which is where endometriosis affects the muscle of the uterus, and that can cause heavier bleeding.
Can it impact fertility?
Yes, so not only does the endometriosis cause a lot of pain, but it can also impact a patient's ability to get pregnant. So in fact, the patients that are presenting for fertility consults, 30 to 50% of those patients may have underlying endometriosis.
So how fast does it typically grow if it can make it all the way up to the lungs and heart?
That's a great question as well, and a question that at this point, more research is needed to understand not only the exact mechanism for why the disease starts, but also how the disease progresses or also regresses. We do know that after a surgery where all of the endometriosis is removed, 50% of the time patients can have recurrence of the disease even after 2 to 5 years.
Wow. So what is the standard treatment at this point? You mentioned surgery. Is there anything else on the horizon?
So treatment of the best and most successful treatment does often require a multidisciplinary approach to the disease. From a gynecologic surgeon standpoint, we typically use a combination of medications as well as surgery. So surgery not only helps to diagnose and treat the disease, medications can be helpful to kind of quiet down the pelvis, is the way I like to describe it. It lowers the estrogen levels, and that kind of controls the symptoms. So oftentimes patients will present, medications are a good first line for treatment. Surgery is oftentimes used as well. And sometimes after surgery, medications can also be helpful. Other treatment approaches do include pelvic floor physical therapy. Sometimes will also require the specialty services of colorectal surgeons, sometimes urologists, sometimes cardiovascular or thoracic surgeons as well.
So if this is related to estrogen, is it maybe the medication you were talking about, is it maybe a low estrogen birth control pill, or what would the typical medication be?
So there's a lot of medications that are different, but have the same goals, and that's how they achieve pain control when it comes to the disease. So a combined birth control pill can be effective, as well as a progesterone-only medication that can come in the form of a pill, a shot, an intrauterine device can also be helpful. There's other classes of medications that do not contain hormones, but act on the hormonal system and lowers the estrogen levels, but not exactly to the point of menopause, and that's how they can be helpful as well.
How common is this?
Endometriosis is very common. It does affect about 1 in 10 women. However, we do feel like that number is probably much higher. And the reason is because it does require surgery to diagnose. And so I always say, if you look for it, you'll find it.
If it requires surgery to diagnose, can they fix it at the same time?
So if fixing it, unfortunately, there's no cure for endometriosis, but there are a lot of different ways to manage the pain. Surgery being one of the most important ways to not only diagnose, but to treat the symptoms. And so it depends on the type of surgery that we're doing. So women who want to conserve fertility, meaning keeping their uterus, their ovaries, their fallopian tubes, we can still do surgery to excise and remove all of the disease that's outside of the uterus and the ovaries, which can provide patients with adequate and oftentimes long-standing relief. Hysterectomy can also be helpful treatment. It, again, is not a cure for the disease, but oftentimes women will seek hysterectomy in order to really help and get their quality of life back.
What's the most important thing you want patients to be aware of?
To be your own personal advocate and know that the symptoms, these pain symptoms, are not normal. You don't need to suffer. There's a lot of providers, surgeons, specialists out there that want to help you. And we listen, and we know that, that you know your body the best, and that we're here to help you. Mm-hmm.
Great insight. Dr. Miller, thank you so much.
Thank you.
Now, most view this disease as affecting women during their childbearing years, but a recent study says endometriosis can affect women their entire lives and put them at an increased risk of stroke. Our Grand Rapids, Michigan TV station talked with researchers behind that study.
On the outside, Catherine Koopmans looks like a healthy mom-to-be. On the inside, she's battling endometriosis.
Well, I've been affected by it with different organs in my body my whole life.
Her symptoms started at age 14 and continued until she was diagnosed at 29.
And I had 3 colonoscopies in 9 months because I was having ulcers, but no one could find the reason for them. I ended up probably seeing 10 to 15 doctors in a 9-month period between ERs, University of Chicago. I went to Mayo Clinic, just trying to figure out what was causing all this, and not one doctor mentioned endometriosis.
Catherine isn't alone. Research out of Yale University found it takes about 10 years for a woman to be diagnosed with endometriosis.
It was a long time, a lot of lost time.
And it's that time that has researchers like Stacy Mismer, a professor of obstetrics, gynecology, and reproductive biology at Michigan State University's College of Human Medicine in Grand Rapids, concerned.
Women with endometriosis do have a what we call a chronic inflammatory state. They have elevated inflammation throughout their bodies across their reproductive years, and so inflammation really was the underlying hypothesis for stroke.
Yes, stroke. Mismer just completed a study of 120,000 women that lasted 25 years. She found that the chronic inflammation caused by endometriosis increases the risk of stroke.
Those with endometriosis do have about a 34% higher risk of stroke.
And that risk spans their entire life, from teenagers to menopausal women. Mismer's study suggests endometriosis could be responsible for blockages in the arteries.
We know that with this increased risk of high blood pressure, this increased risk of hypercholesterolemia, that women with endometriosis might have a higher risk of just the plaque and other deposition that's more common to strokes.
Mismer hopes that her study paves the way for medicine to begin looking at women's health as a whole, not separating gynecology from the rest of her body.
We're very siloed in how healthcare works, that a gynecologist may not be thinking about these cardiovascular issues, where a cardiologist might not be thinking about these reproductive and gynecologic issues, but also that's a very important footprint for primary care doctors, family medicine, pediatricians, particularly given that endometriosis and its symptoms arise primarily in adolescents and young women. So often things like heart disease isn't on the radar at that point and really does need to be.
And Catherine agrees.
It affects the whole body and every system of the body.
Catherine isn't just aware of her increased risk of stroke, she's also more aware of the symptoms, which she hopes will help protect her daughter in the future.
So I'm just glad that I can watch for the warning signs and, help early on.
A Tennessee native who makes music around the world tells of her struggles with the disease and how she's trying to educate more women about it.
I don't know. You stand there and, the first couple seconds you're in the room, and then after that I'm gone. I am in another atmosphere. I just leave.
An out-of-body experience, reaching new heights with every breath.
From day to day. Singing has just been a part of my life, all my life. Being from Memphis, it's the very fiber of who I am.
And who she is Brittany Moore, also known as Dottie.
I'm just a little girl from Castalia, by way of Whitehaven, humble beginnings.
With just $300 in her pocket and priceless hope, Dottie sought out what her soul couldn't hold in.
Which $300 don't last in California, let me tell you something. By day 3, I was hungry. When I went out there, I was not playing. I had that hustle that I think us Southerners have.
A hustle that's led to touring with artists such as Kendrick Lamar, J-Lo, Ciara, and currently Ella Mai.
My style is just being raw, being in your face, being Memphis, girl. I've been around the world 3 times over, and there's nobody like Memphians. Just the spirit of us. I know.
A spirit that flows even through adversity.
I'm dealing with endometriosis and adenomyosis, which is a disease of the uterus, which has really affected the way that I work. Being in a pandemic and being sick, just losing my mother, it's all been kind of tough.
But tough can't stop purpose.
The awareness of this disease is what is driving me. Outside of music, I'm going around and trying to let women know that they need to pay attention to their bodies. I just got fight in me. I don't lay down. Something I would say comes from my mother.
And at times,
telling life, you're not gonna beat me. We either gonna do this together or you're gonna have to take a back seat.
Because the front is occupied by hopes and dreams. I'm Brittany Moncrief.
Endometriosis is a common condition, but often misdiagnosed. It's important for all women to pay attention to their bodies and speak up for themselves. That'll do it for this edition of Prescription for Life. We'll be back next week with another dose. Until then, I'm Monica Robbins, wishing you and yours good health.
Thank you so much for tuning into Health Yeah. Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Find video podcasts at Monica Robbins' channel on YouTube. And please subscribe. Wishing you great health and hope to see you again soon.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.